Child sex exploitation is something that I think the media talks a lot about, but we don't always know what it means, and there is confusion as to what exactly it looks like in practice and the best way to respond. Because sometimes the young people look as if they're consenting to their abuse, which is not actually the case. There are dynamics which sit behind child sexual exploitation, control and coercion, which might make it look as if a young person is consenting, but actually that's not the case. We have produced 2 types of papers, one for frontline practitioners in terms of how they respond to child sexual exploitation, and one for commissioners, which talks to them or makes the case as to why they should put resources into this issue and support practitioners on the front line. We have written those papers for people working within the police service, for people working within health services, for social services. Sexual exploitation will be something that all practitioners are aware of, and they probably have extensive guidance in relation to this issue, and sometimes that can be overwhelming. The idea of the research briefings was to distill down key messages which should underpin their practice. Very short, very simple, something for them to remember, and importantly for it to reflect the knowledge base as it is at the moment, so something that's really up to date and which will help them in terms of their response. So there are 4 sections within each paper. One provides a brief overview about child sexual exploitation, what it is. It then moves on to who is affected by child sexual exploitation, and then for each of the different audiences to whom the papers have been targeted, we then talk specifically about messages from research which will help professionals in that area. So for example, the section related to this in the health paper will talk about how young people access healthcare across a range of different healthcare services, and how professionals need to be trained to recognise what the warning signs might be in relation to child sexual exploitation, and to very much focus on what might be sitting behind the presenting symptom. So not just to look at the fact that a young person might be distressed or that they're self-harming, but to actually ask questions as to why that young person might be self-harming, and to be aware that sexual exploitation might be a reason why that is the case. The papers bring together everything that we know about child sexual exploitation in one place and distills it down to what the key messages are. So the most important things that practitioners should have at the front of their minds, or the most important points that commissioners should be aware of when they decide how they're going to spend their money. We always hope when we do work like this that it will make a difference. Quite often people see academics as sat in ivory towers, and the knowledge that we create is not something that is relevant to people on the front line and to what they're doing. So the idea is to take that research, to present it in an accessible format, and to make sure that the knowledge is understood by others so that the response to young people can be the most effective that there is. Young people are experiencing child sexual exploitation as I'm talking to this camera. It is something that affects young people from across the country, and it is something that needs to be responded to. And the better we understand this issue, the more effective we will be in terms of responding to it and making a difference in those children's lives.